What I'd like to demonstrate today is what I go through to eat. I'm eating a hamburger right now. I actually have to cut it up into small slices, so I'm going to cut one right now. Okay, so this slice, which is only this big, it's not a very large slice, but I can't eat that anyway, that's too big. It has to be half of that. So now this piece right here is let's get this relative to a French fry, let's say. Let's get a couple French fries in here. Okay, now most people can fit a French fry through their mouth, right? So this is not such a big bite. Most people shove a French fry in. Well, I'm just going to put some ketchup on there. Now, the only reason this is going to fit in is because I'm missing these teeth on top right now. As soon as they get put in, there's not going to be much room to put any food in my mouth. But this is how I have to eat every day. Every bite, no matter what it is. The right side opens less than the left side. So it's easy to push food to the left. But my tongue doesn't go in the places it used to go. It's further back in my head, so my tongue is not reaching the places that it normally reaches in order for me to masticate the food properly prior to swallowing. So every bite has to go through this process. Now I did cut those very small. Of course, when you're eating, I'm trying to get at least a bigger piece in my mouth so I can get this over with. As soon as I put a big piece in, I mean, the fry wouldn't be so bad, I guess. But it takes about an hour to eat a hamburger. If I'm in a rush, I don't have a choice. I cannot rush eating food. This is how long it will take me for the rest of my life. And obviously, you wouldn't do that, and you would not stand for that. I'm sure you would have yourself fixed. I want to make sure I have myself fixed. Because nobody watching this video would ever do what I just did for the rest of their life. I know nobody else would, so I have a right to be just like you. Get myself fixed. It can be fixed. I'm an engineer. I've seen the pieces and parts that he puts together. I don't know what Dr. Clark is. I'm not going to go crazy on Dr. Clark. But I didn't ask for him. I don't know how he wound up doing my surgery, but I'm going to say he needs to practice again, okay? Because he's not very good at what he does. Or he's supposed to be doing something else, like fixing shoulders or a knee or something. I don't know. I failed to mention, I just realized the other night when I was driving home from a friend's house, I was starving. I saw Burger King. I said, let me go through the drive-thru, get a cheeseburger. And I didn't even pull in. I said, I can't eat a cheeseburger. How am I going to eat a cheeseburger? I need to sit down at a table with a knife and a fork. I can't go down the road and eat a cheeseburger. Those days are over. Now this is a regular burger. That does not even fit in my mouth with me missing teeth. I would have to shove that down to get that in my mouth. And most people can swallow this very easily. It's not even the size of a golf ball, very small. Just a little bit bigger than that French fry. I'd like to go back to Burger King someday. Can I? This piece is so small, I don't want to cut it in half. Because then it's hard to pick up and, you know, messy. So, this I have to wedge in my mouth. Because my lower jaw is back, my lips don't meet anymore, so it's hard to keep my mouth closed when I eat. That's why I normally eat with a napkin in front of my face. I really don't go out to eat with people anymore, to be honest. I'll wait till I get fixed. That is very tiring. I'm not even getting it chewed down, that you normally do. Chunks are going down my throat. I wouldn't want anyone to live like this. You can't. You're just not going to make it. It's too much of an effort putting in to eat. Your energy swap is just even right there. I don't have any energy to go through the rest of the day. The energy I'm using to eat, I'm just getting from eating. Not good.